Hey, I'm Dr. Michael Johnson. I have a private practice in Gadsden, Alabama. It's Dr. Michael Johnson and Associates. So, what kind of questions do you have for me today?
So, why is the Eclipse membrane your choice for amniotic treatment in your practice?
Great question. Um, there's a lot of amniotic membranes out there, and this one really kind of fell into my favorite or my membrane of choice out of necessity. I was working, or I still am, working with a device company, and we were actually developing the protocol to treat and manage a dry eye sequelae of issues. It's called conjunctival chalasis, where the lower portion of the conjunctiva on the lower part of the eye gets loose tissue. And so there are ways to treat it. You can definitely treat it with topical eye drops. If it's very severe cases in the grades 3 and 4, you can do surgical resections. And then you can also apply amniotic membranes. It's one of the billable codes that you can treat it for. We're finding that it takes longer to just apply a membrane and actually see results. So we're working on a procedure. And we needed a membrane that was durable enough, pliable enough that we could apply the plasma heat and secure the membrane in place and not have your prototypical folding or the stingray effect where when the membrane gets close to the eye, it tends to fold upward with some of your thinner, um, more fragile membranes, if you will. So we were finding a membrane. We wanted the right size. We wanted an 8 millimeter or a 10 millimeter lens, one that we could actually cut or manipulate, if you will, but still not lose its structural integrity. And we came across Ophthalogix through a group that I work with, nursing homes, and this lens was being used in all kind of clinical applications, and it was not moving once it was secured in place with a spear or a wedge. And we also found that the folding, when you apply it, in some cases you would have a fold that we could actually manipulate it and put it back in place and secure it and not cause any issues. Uh, the, the other beneficial effect is that this lens, we know the way it was treated and preserved and processed, that it had the highest amounts of your anti-inflammatory properties. It had the least amount of preservatives, and it could be stored for a long period of time. So this lens this membrane, if you will, marked all the boxes. One of the other reasons, not just from that clinical trial perspective, but in my clinical modality, one of the other reasons that I've kind of gone to the Eclipse lens or the Eclipse membrane is my membrane of choice. I treat a lot of patients that come from referrals from a cancer treatment center, and they're on a lot of long-term medications, specifically drugs that are maintenance medications, maintenance chemos, and then there's a whole classification that's for multiple myelomas. That we know these drug categories are going to cause a bilateral keratitis, specifically a neurotrophic keratitis. And so there's a risk that if you're replacing a membrane that is a double layer or of a not pure quality membrane, that you're going to induce some form of hypoxia, potentially some corneal infiltrates, which would also degrade the corneal system even further. So this membrane, marked all my boxes. I found that it could be applied, whether it's with a bandage, contact lens, or a pressure patch with tape, and I would feel secure knowing that that lens is not causing any higher risk of hypoxia or side effects. I also know that I can manipulate the membrane once it's applied on the eye and not have the risk of it just disintegrating or completely being fragile and falling into pieces. So yes, the Eclipse is my preferred membrane of choice. It marks all of my boxes clinically, and I know that when I order this product, I'm not going to have the fear or potential of actually wasting the money of a material by it being applied and tearing into pieces or being completely folded and ripped into shreds once we apply it to a heated conj or to an eye that needs recurrent treatment.